Hello, my name is Aida Matek, and I'm the Administrative Director of Philanthropy at Tidewell Hospice. And this is my colleague, Irene Henderson.
I am the Administrative Director of Volunteer and Professional Services and the manager of the Tidewell Honors Program. The Tidewell Honors Program was created in 2008 to honor veterans and provide specialized care for hospice patients and families of veterans. And thank you again to the Venice Community Foundation for the generous grant, because the grant helps us provide different specialized care to the veterans. And we have some of the examples here on the table. I am a Navy veteran, and I am a Navy nurse, retired, and I was pinned with the Tidewell Honors Pin. Part of the beauty of the Honors Program is we offer a very heartfelt pinning ceremony. And we have 3 different types of pins. One is our Tidewell Honors Pin, that we pin our Tidewell patients, staff members, and volunteers. And it was specially designed for Tidewell Hospice. The other pin is a very sweet little angel caregiver pin that we pin the family members and the caregivers of our patients. It's very unexpected for the family member, and we want to recognize the care and sacrifices they make to our patients. And then we have a Florida Hospice Partnership community pin. Tidewell is very active in the communities pinning veterans during different holiday appreciation events such as Veterans Day and Memorial Day. The patients are pinned at nursing homes and assisted livings, and residents are also pinned at the same time. And because of the generous contribution by the foundation, we have been able to provide for 55 pinnings to Venice area veterans last year. We've also been able to do 3 veteran legacy projects, which can be costly, and our grant has helped us to buy the DVD, supplies, scrapbooks, pictures, craft paper to create these legacies that for the families and the patient, and also for the pinning ceremony. This is an example of how we honor our veterans in the hospice house in Venice. This patient is a veteran, and we always identify a veteran for anyone who is in the house by placing a stick flag in a brass holder at the door. That automatically alerts staff and any visitor that here is a veteran in this room. The nurses and the physicians, all the staff, as they're observing the patient and they note certain symptoms, they are alerted this could be related to the patient's military history. They would talk to the patient, they would look at the patient's medical record to see if the patient saw combat or had any issues while in the service. This could affect medication regime. It could affect the entire course of their stay at the house, because if this is indeed not related to the disease but related to a post-traumatic stress from combat, there is a different approach, different counseling, perhaps different medications, different focus to their care. They would approach the patient to see if the patient wanted to discuss any type of the military experience. If the patient does not, we honor that wish. However, it can affect the different treatment modalities, and we design it specifically for that veteran. And our patients and veterans, volunteers and staff truly appreciate the grant that you've given us.